My name is Professor Olusola Ayanlowo. I'm a consultant physician and dermatologist and the head of the dermatology unit of the Lagos University Teaching Hospital. I'm here to talk to you today about the World Leprosy Day, which is holding on the 29th of January 2023. The theme for this year is Act Now, End Leprosy. So the World Leprosy Day came about basically to let people know what leprosy is all about, to reduce the stigma, to speak to the stigma and ostracization associated with leprosy. So it was first celebrated by Ralph Folero, a French humanitarian, to celebrate Mahatma Gandhi, who worked a lot among people with leprosy. So we need to know what leprosy is. Leprosy is a bacterial infection caused by an organism called Mycobacterium leprae. The organism lives basically in the mucosal membrane, that is the coverage of the mucosal surfaces of the body, like the mouth, the nasal nose, and it also lives around nerves. So most times when people have leprosy, there are different types of leprosy. The most common one is when people have patches. A patch in the skin may appear lighter than usual, and then there will be loss of sensation or abnormal sensation. Somebody can say, I don't have any feeling in that part of the body, or I feel tingling sensations or abnormal sensations in that part of the body. It also affects the nerves. So sometimes somebody will tell you that when I step on things, I don't feel pain, or I don't know that I've stepped on anything. Occasionally, they could have swelling of the hands and the feet, and then they could also have issues with their eyes. And then sometimes they also have skin problems that affect the whole of the body, and that is the extreme type of leprosy. The one with nerve and the skin affection is the mild type, but the other type that can affect the whole of the body, that you can have swellings and bumps all over the body, can also have abnormal sensations. That's the extreme type of leprosy. So the most important thing you need to know about leprosy is that it is curable. It's an infection and is treated with combination of antibiotics. That I'm talking about should present himself to a doctor and get referred to a hospital like Lagos University Teaching Hospital at our dermatology clinic for us to make a diagnosis of leprosy. So apart from looking at the skin and confirming that this is likely to be leprosy, we can do some investigations and to confirm that the person has leprosy. And as soon as we confirm, we treat leprosy. So we are very well able to treat leprosy at the dermatology clinic, which is situated at Ave Road, Yaba. We're able to diagnose it and treat it. So the most important thing about leprosy is for it to be diagnosed very early, before it brings out the what most people know about leprosy is the deformities of the hands and the feet, and this only occurs because that particular person did not get to be treated or to be diagnosed early. So the organism is able to cause damage and long-term damage to the body, like the deformity and sometimes the blindness that they cause. So the key to prevention of for us to be able to diagnose leprosy early. So what are the possible long-term complications of leprosy? Number one, they have loss of sensations. They can't feel any pain. So when they have wounds, they may not even know that they have the wounds until the wounds have become big and complicated. The wounds on the skin could even go to the bones and cause bone infections. And then deformity of the skin and the bones. You'll see the mobility of their joints. Their hands become stunted. Some people may have difficulty in walking. In some people, blind affect in some internal organ. It could cause joint pain sometimes. So anyone with patches on the skin in which they find out that they are having abnormal sensations, they can fit, or they step on things they can't feel, or somebody says I can carry a hot pot without feeling pain, and that I need to for investigations. So the skin clinic is powered to treat everyone with leprosy. So we trained, I myself along with my other colleagues, Dr. Akube, Dr. Fadu, we have been NGOs like the German Leprosy Foundation, free drugs for patients with leprosy. So what we do is that after we've treated, we've diagnosed them and written our prescriptions, we refer them to the point at which they can get the drugs free, and then every month or every other month they come to us and we monitor that they're responding to the treatment, they don't have any complications, and they don't react to the drugs. We're also involved with research and awareness, just like I'm doing today on leprosy. We, along with that, myself and my colleague, we have been involved with training other physicians, the medical officers, the and who are the first point of call. We've also trained nurses too, and the community health workers as part of our community efforts to prevent leprosy, on how to recognize leprosy. So we expect that when our colleagues who are the first responder, and patients usually complain to first, see any of these signs in the patient, they refer to us. We also expect that the nurses, the community health workers who see patients with leprosy first will refer to us to diagnose them. The key to it is that even if you suspect leprosy, please present yourself if you are not a doctor, and we don't expect you to just go to the market or to the pharmacy and be giving drugs, because that's usually what happens. People get to start giving steroids and then they waste time. So this disease keep festering and gets to the point at which patients now have deformities. So my message to you today is that if you find a patch on your body or on anybody's body, you are your brother's keeper, and that suggests that this might be leprosy, please get to see the doctor and get yourself referred to the skin clinic, a dermatology clinic like we have at Lagos University Teaching Hospital, to be diagnosed properly and to be treated properly. And then as a physician, and this also goes to my colleagues or the other healthcare workers who may be the first responder, maybe a pharmacist, people come to you at your shop, or you're a nurse or you're a community health worker, please refer your patient to get treated. Our aim with the World Leprosy this year is to let you know that anyone with leprosy can be treated at the earliest possible sign or symptom of leprosy. Anyone with leprosy can be cured with combination of antibiotics which they may need to take for up to 6 months or more. And anyone with leprosy does not have to get to a point where he has deformities. Of course, there are facilities also at the Lagos University Teaching Hospital to treat anyone with deformity, but we don't want you to get to a point where you have deformity. So I would like you to take that home, that nobody, and then people with leprosy are not contagious. The fact that I greet you, I shake your hands, or I hug you does not make me, the person with leprosy, transmit leprosy. So leprosy is not transmissible by just touching. It requires prolonged contact. So usually people that can transmit leprosy to themselves are family members who live together for a very long time. So once again, my name is Professor Olusola Ayanlowo. I'm the head of dermatology for the Lagos University Hospital. I, along with my colleagues, are well positioned to identify and manage leprosy, and leprosy does not need to get to a point in which people would have deformity. Leprosy, anyone with leprosy does not have to be stigmatized, because it's just an infection that is curable. Thank you.